Larissa Corder, who's a fertility specialist and has been transferred to help in an intensive care unit at a hospital in South London. Thank you so much for talking to us this evening. I'm going to start first with those hospital admissions. There's been a drop in hospital admissions, according to those figures that we just saw. Have you seen evidence of that where you're working?
So there is some encouraging news in the sense that our intensive care units are experiencing fewer admissions. We are seeing that. However, we still operate at a very high capacity and we're still operating intensive care across a number of different wards. A lot of the patients who are still here still remain really poorly. They are now beginning to turn a corner. But what we're seeing with this disease is that sometimes as patients improve, they can suddenly start to get unwell again. And we're still learning a lot about this disease and how to treat it, and are finding ourselves in a situation now where patients have been on ventilation and multi-organ support for quite a long time, that we're actually beginning to run out of some sedation drugs and have to change our protocols in order to accommodate for that. So this is far from over. It's a slow and gradual process, but we still remain in a critical situation.
I mean, it's incredible that you can talk about running out of sedation drugs because the number of people that you are treating. What on earth is that like for you as a doctor to be dealing with that every day?
What you're doing is essentially seeking guidance on what alternative drugs you can use that are just as effective. It's a really difficult situation to be in because, of course, the manufacturers are doing their best to meet the endless demands. We've never seen ITUs all across the world full to the brim with patients. It's never happened before, and this pandemic is causing an incredible strain not just on PPE, as we're well aware of, but also the drugs themselves that we use in intensive care. So we really are doing our best in terms of what we have, but we do need more supplies. And it's a case of when we're offering multi-organ support, especially when we're trying to filter patients, some of these filter machines again are not as readily available, and we have to rotate patients through them. So we're really dealing with it as best as we possibly can, and this is the case across all hospitals.
Now, you're dealing with a lot where you're working. You talk about those patients who are in ICU and also the numbers of people who are losing their lives, and you're having to deal with that as well. How do you deal with your own mental health at the moment? Are there any sort of tricks that you're using to try and keep yourself sane?
That's a really nice question to ask. And yes, I mean, I think it's such an important thing. And we're all well aware of the strain, the mental strain and emotional strain that this can take on all of us, especially not just seeing all these patients who are so ill, but also seeing the death toll among NHS staff as well. And that becomes really difficult to deal with. So we do have support. We do have counselling support that's provided in our wellness hubs across all hospitals. And also we are personally sent emails with support via links to meditation, yoga and classes like that. I mean, I'm someone who's been into that for a while, so I find I have my own practices that are helpful. But for someone who's new to this, it can be really, really overwhelming. And we're just there for one another. The camaraderie is incredible. I can't even begin to tell you how being on a unit like this, it is just the most amazing place. And there's a lot of hope, there's a lot of excitement for the future ahead to get these patients better and get them discharged home to their families.
Oh, well, Dr. Larissa Corder, all of those families, I'm sure, are incredibly grateful to you. Thank you so much for talking to us this evening.
Thank you.